So gum disease, what are the symptoms and what are the options to take care of it?
Sure. So for gum disease, some of the symptoms would be teeth that move a lot, bleeding when you brush your teeth, or bleeding gums, flossing and having blood at that point, infection in the area, sensitivity, bone loss, recession. In general, all of those factors can be involved in bad breath, of course, as well. The way that we can treat that is really in general.
Because you're a periodontist, right? This is what you do.
That's what I do. It's what I was trained to do. It's what I'm a specialist in. And there, in general, are two camps now in periodontics. One is the traditional way, which is where we would go in and we would do surgery on those cases, where we peel back the gums and adjust the bone and close everything up and sew it up together.
Are you scraping out
you're
the bacteria?
That's what you're trying to do. You're aiming to scrape out all the bad stuff underneath and hope to get it out. It's kind of actually a little bit impossible because bacteria get into the gums, they get into the bone, they actually penetrate in, so you really can't get them out that way all the way. The second way that we do this now, which is what I'm a proponent of and what we do a lot of, is LANAP, or laser-assisted new attachment procedure, or laser periodontal therapy. And what we do with that is we actually use a laser that penetrates beyond just where it shines and eradicates or gets those bugs and those bacteria out of the way. It's like a heat-seeking missile trying to get those bugs.
Okay.
And that's something it's an amazing tool. You're able to provide that and utilize it and get very similar results and far less trauma, far less recession, far less pain. And it's not a surgical procedure. There's no sewing and there's no cutting. And that's quite a great alternative.
So I'm straight on this. So if you have gum disease, right?
Yes.
Bacterial, that's the number one way you lose your teeth.
Yes, number one way is by gum disease, absolutely.
Okay, so they could either, you go to a dentist, and is this common where you are, where like every day they go in and they get this periodontal traditional therapy of peeling back the gums?
Absolutely. You know, a lot of the other doctors that are in my office, for 30, 40 years, that's what they did every day. Every day people came in, they peeled back the gums, they adjust the bone, they scraped everything out and close it.
They have to sew back?
That's right.
Okay.
They've got to sew it back. And that's what they were doing every single day. Whereas now, it's funny, I've got them all to switch to lasers. I've got them all because they see the results. They see the fact that they can get the same results without having to do those other traditional procedures that are, honestly more aggressive.
It is a bacterial infection. So what, you go around the mouth with a laser and it kills the bacteria?
Yes, it goes in and kills the bacteria, and then we're able to seal things up, and you see tissue regenerate, bone regenerate, things regenerate back to where they used to be, and maybe not all the way, but you get a great resolution. And it's amazing, it's mind-blowing, because there's some areas where, years ago, I would have pulled those teeth. I would have taken those teeth out because they were hopeless, they were moving, and after laser therapy, they're still there. And they're still sticking around. And for a patient, it's amazing because they feel like they've tried everything under the sun to try to keep their teeth, and they finally found something that works. And that's a great service to offer.
Now, here in the U.S., less than 10% of dentists use the laser for gum treatment.
Sure.
They do the cutting therapy. Sure. What's it like in Canada?
Well, in Canada, LANAP, or laser-assisted new attachment protocol, is a very specific laser that's utilized, and it's proven through research to really use the laser to do a very good job in eradicating these bugs and treating periodontal disease the way we want to treat periodontal disease and gum disease. I would say less than 5% of dentists in Canada actually have the laser and actually utilize it. And
which one costs more to do?
Both of them are about the same. If you look at, if you had to do surgery in all 4 areas and versus having to do LANAP, it's very comparable, if not the same, and it's less painful. The procedure is quick, and in honesty, it's atraumatic, which is quite nice.
Okay, now you lecture to dentists all over the country,
all
over the world, I guess.
That's right.
And when they ask you about laser, because you're a periodontist, to get rid of gum disease, do you get a lot of questions like that? And what do you say?
I say
it works?
It works. And I also say the results speak for themselves. I was able to not only treat patients myself, but see patients that have been treated for decades, and 10 years and 12 years ago, and they're doing so well now. Teeth that, when I looked at the readings, that they should have been lost or removed, and we're able to keep those teeth, and they're still around a decade later. That's amazing for a patient.
So in your area, there's probably hundreds of this older technique being done,
sure,
right? So what do you say to those people? Maybe they're scheduled. Get a second opinion?
Well, I think a second opinion for everyone is worth it. Many people come to our office for second opinions, and it is a procedure that works, and it's less traumatic, and I think the results speak for themselves. And the benefit is, at the end of it all, they get to keep more teeth. They've got a beautiful smile, because our smile means so much to us. Their breath smells better. Teeth are not moving as much. There's not as much bleeding of the gums, and in general, things are better overall. And that's what you want to do when you treat that disease.